Hi, my name is Edna Kurgat. Welcome to HLTH 623 Cultural Anthropology Cultural Solution. And today I'm going to be presenting on the Dinga Culture Group. And yeah, let's get started. I am going to start with the presentation outline overview, which I will address the description of the culture group, public health issue, program proposal, program implementation, budget, and the evaluation. So the Dinga Culture Group. This group makes up the largest ethnic group with 35 to 40% of South Sudan, as you can see on my geographical representation, and they inhabit along the seasonal swamp and river Nile. And the reason is because these people are pastoralists and agriculturalists, so they have to live along the rivers in order to have access to water and cleaner pastures for their livestock. And they also believe in spiritual leadership, and they offer sacrifices for their ancestors, which is known as Nilak. They practice polygamy. This means men are allowed to marry up to more than 2 wives, and it's in accordance with their culture. Food, they grow millet, and they practice fishing. And Dinga have low level of literacy, which explain why their level of employment is low within this particular group. And they practice fighting skills by spear and shields as form of sports, and craft and hobbies. Women practice pottery, while men practice fishing, and women also practice weaving. Description of the health problem. What is cholera? So cholera is prevalent across South Sudan. It's a waterborne illness that is caused by Vibrio cholerae, bacteria known as Vibrio cholerae, and this is caused mainly due to lack of safe water and poor sanitation in South Sudan. And approximately 59% of the South Sudan population lack access to safe water, and only 10% have access to clean water. That explains the reason why cholera is prevalent in this particular population. And cholera may lead to acute water diarrhea, affecting 20% of the infected individuals, and 10 to 20% severe water diarrhea. Patients who do not receive from an adequate treatment can suffer a severe dehydration and may even lead to death. The major risk factors of cholera in South Sudan is contaminated water sources and food, poor sanitation, and lack of hygiene in this particular region. For example, the Dinga population practice open defecation because their houses don't have access. The Dinga houses lack latrines or toilets, and you find that as of 2020, 6.7 million South Sudanese did not have toilets or practice open defecation, and 2.6 million lack access to basic sanitation facilities. That increases the risk of cholera. A brief overview of cholera outbreak as of 2023 in South Sudan. So as of April of 2023, as you can see on my slide, 9 of 5 cholera cases and 2 deaths had been reported. Children are the most vulnerable, with the highest percentage of 50% of the total cases reported. The reason could be because children are compromised immunity, and that makes them prevalent for the infection. And compared to female, men had higher percentage of 53 over 47 of female. This is attributed to cultural activities. For example, in this culture determines cultural roles, gender roles. For example, males are this responsibility of men to take care of livestock, and that's why in most cases they are out there looking after their livestock and drinking water that has been contaminated by their livestock. That explains why they have higher prevalence compared to female. And in 2023 February, we had 7 cases compared to 9 or 7 cases in April, and the trend is increasing, which calls for the need for a program to address this problem and lower the incidences of cholera within the Dinga cultural group. The overall goal is to lower the incidence of cholera illness among the Dinga people by 2030, and the objective is to increase cultural competence training among healthcare professionals. The next one is to enhance educational awareness among the Dinga patient, and lastly is to ensure adequate supply of materials such as soap, water purification, and jerrycans. So what are SMART goals? In this case, SMART goals are specific, measurable, achievable, relevant, and time-bound. So this program is specific, meaning that the specificity addresses what needs to be accomplished, which is lowering the incidence of cholera among the Dinga patient. Who is responsible? Healthcare providers and the Dinga cultural group. Steps to be achieved is educational awareness and sufficient supply of cholera prevention material and prevention interventions. Measurable means that the program is quantifiable. In this case, you are going to assess the participants' knowledge of what the program have teach in order to prevent the increased cholera in this increased spread of cholera in this particular region. So we will achieve this through the use of questionnaires. For example, in here I have a sample questionnaire that the program is going to use to assess the participants' knowledge. That's open-ended question on how well informed the individuals are, the preventive strategies, measures they have learned, how often they practice hygienic practices. So some examples, those are just examples of the open-ended questions that the questionnaire is going to use to analyze and assess the knowledge of, to measure the participants' knowledge. Achievable, the program is overall goal is achievable as it aligns with Global Task Force of Cholera, which is attaining 90% reduction of deaths by 2030. It is relevant because because cholera is endemic in South Sudan due to poor access to clean and safe drinking water, and 2.6 million people lack access to any form of basic sanitation facilities as per 2020. The Dinga people also live in semi-permanent houses known as PI, which lack toilets, hence they excrete in pushes, and when it rains, it gets washed along the streams, contaminating the water sources. It is time-bound in that the overall goal will be achieved by 2030. However, increase in behavioral changes such as frequent hand washing is said to be achieved within the 6 months from when the program starts. Program strategies involve this patient-centered cholera education seminars, water sanitation and hygiene intervention, healthcare system, strengthening of healthcare system, treatment intervention such as oral rehydration solution and oral cholera vaccine, and community mobilization. And we will be addressing leaders as agents of change to improve communication and control strategies for hygienic practices in this particular region. This is just a definition. So these strategies promote a patient-centered care approach, which allow healthcare providers to understand the Dinga culture, behaviors, and health beliefs. It will also allow the Dinga people to feel comfortable while sharing their health informational needs. And that's just a definition of patient-centered care, which ensures that there is a patient advocacy and individual care is enhanced. The budget. My source of funding for the program is coming from both non-government and governmental sources, which is private donors and fundraising. And for private donors, we have individual, private sectors, and organizational grants. Membership dues for profit companies such as airlines and sales of goods and services. And we will also partner with governmental agencies such as WHO, USAID, and even local universities. And we'll even have graduate students from universities being volunteering and being part of the program to help in establishing the program within this particular organization. Okay, this is how my funding is going to be distributed. As I mentioned, education is going to be a big part of the program, as it's an empowering tool that enables the people to make effective decision when it comes to health decisions. So we are going to use 38% of the fund of the budget together for educational and training materials such as pamphlets, sanitation materials, and treatment supply. Salary and wages will cover 20% for volunteer stipend and healthcare workers and even the community participants. Equipment and supplies such as laptops, pens, and screen projects. Travel expenses such as food, lodgings, and miscellaneous expenses will cover the remaining 6%. To assess participants' understanding of cholera symptoms. So how is this program going to be evaluated for its effectiveness? Is we are going to utilize pre and post survey to assess participants' understanding of cholera symptoms, treatment, and prevention. So we will also utilize the survey to ensure that there is effectiveness of the program, outreach campaigns such as community involvement with the use of posters. So during the training seminars, we will utilize the use of posters such as this one to educate the community on the cause of cholera bacteria, which is Vibrio cholera, proper hygienic practices. For example, this community practice, this cultural group are pastoralists, and that's a picture of a lady milking the cow. So we will teach the importance of proper hygiene, such as washing hands before milking the cow, and the symptoms of cholera, and ways to prevent it, such as washing hands, utilizing toilet, and washing hands after changing the baby's diapers, cooking food, and different ways of preventing cholera. We will also offer some brochures to increase their knowledge. And another thing is we will utilize 360-degree feedback questionnaire to measure the healthcare profession competencies seen from their patient and peers perspective. And that's my references. Thank you.